Hello, everyone. We're going to give it a second just to let everyone in, and then we'll get started.
Suit and ties today. You guys are looking good.
All right, welcome everyone. We'll give it one more second before we get started to get everybody in.
But then I thought, well,
Okay, welcome everyone. We'll give it one more second to get everyone in, and then we'll get started. All right, thank you for joining us today for our media availability. We're going to give you an update on COVID-19, and joining us today we have Dr. Eric France, Chief Medical Officer for CDPHE, and Kevin Klein, Director of Division Security and Emergency Management. And I'm Heidi Bosk, and I will be your moderator. And we'll start with a brief presentation and then go into a Q&A. And I'm going to go ahead and start with Dr. France.
Thanks, Heidi, and good afternoon, everybody. Thank you for being here for this update. Well, today is another day of increasing cases. As you see in this graph, our cases have been going up considerably exponentially, really, over the last month. This picture here shows you us topping at close to 3,500 cases in the last few days. I'll say that today's numbers are even more worrisome. Almost 5,200 cases today in the state of Colorado. Next slide. Our hospitalizations too have been going up. Today we have almost 1,200 hospitalized in the state of Colorado. Yesterday's cases were based on over 44,000 tests. So certainly our testing is going up. So we do identify cases and higher numbers of cases with those high numbers of testing. But the hospitalizations should really be a strong and solid reflection of data that demonstrates just what's happening, irrespective of the amount of testing happening. Our numbers are clearly rising in our hospitalizations. And we see too on the next slide that our positivity rates are also going up. Next slide, please. Our positivity rates week over week have gone from the low 3% towards the beginning of September around Labor Day. And now over the last 4 weeks, you see positivity rates climbing from 6 to 7, 9, 12, and today's positivity rates are sitting at 12.5%. We follow positivity rate as a measure of whether we are doing sufficient testing. Our goal is to keep positivity rates below 5%. If we're doing that, that means we're capturing most of the cases and identifying them so that people can isolate at home and those who are exposed can quarantine. At rates of 12%, that means there are people out there who are not being identified through testing and therefore could be out and about and not either isolated or quarantined as we'd like. So certainly today represents another difficult day in this pandemic. Cases are an all-time high, hospitalizations continue to go up, and positivity rates are also high. Next slide, please. Of course, we've also been trying to address this increasing pandemic through the work to mitigate some of the things we know drive the pandemic. We are looking, for example, at a number of decisions and policies that occurred over the last 2 weeks that we are hoping will have impact in the current period and the weeks to come. So on October 23rd, the governor issued a new limitation on gatherings to no more than 10 people and no more than 2 households. My hope is that this week and next, the fact that Coloradans are limiting their gatherings will be translating into lower case rates. Between October 24th and November 3rd, we moved counties on the dial, the dial that we use to mitigate and close down and reduce contacts. You'll remember that I think it was the 26th and 27th of October that Adams and Denver counties moved to the level 3, in which non-essential businesses, restaurants, houses of worship were all limited to 25% of their capacity. Those kinds of mitigating effects may impact the growth in cases starting sometime next week. And then more recently, this past weekend, we see our counties are stepping up and are putting in return to home by 10 p.m. or curfews as they do more and more to try and avoid moving to the next step on the dial, which is the stay at home. So these mitigating efforts, we're hopeful will start to translate into a slowing of case numbers and hospitalizations. Next slide, please. This just describes a little more for you the movement on the dial across our counties. Of the 64 counties, I count 30 on this slide that have moved either last week or this week. And at the bottom, the orange is really the last phase before moving into stay at home. A number of them were moved this last week, and we have a fair number more that will be moved to the orange this week. Again, that requires that there's a smaller capacity level down to 25% for businesses, restaurants, non-essential businesses, restaurants, and churches, for example. There are a number of activities that are limited when you move into orange. And of course, our hope with all of this is that these are the kinds of local interventions that will help control the spread of this pandemic in these local communities. Next slide. While we can impact the pandemic through these local interventions and potentially state interventions, we have to remember that it all begins at home. It begins with us as individuals. We all have to recognize the very important steps that we all should be taking. As the governor has asked, we should only be interacting with those in our households, doing our best to avoid any social interactions with friends and family outside of our homes throughout the month of November. This will be extremely important for us to try and slow down the pandemic. Of course, we know that there will be the opportunity to continue with our essential activities, grocery shopping, essential jobs. All of that still needs to continue. As much as possible, every business, every family, every individual should be thinking about how can we stay at home during this month of November. If we are out and about, it's important that we keep our distance, doing our activities outside, and of course, wearing our masks. The CDC just released yesterday's new information, a new brief describing the value of masks, both for the individual to protect themselves as well as protecting others. All of us in Colorado should be wearing our masks when we're outdoors or indoors in essential jobs or in our shopping centers. So please do your part as individuals, as families, as households, as businesses, so that we can control this pandemic. Next slide. We've heard some good news this week around vaccines. Of course, Pfizer's announcement, we expect an announcement from Moderna later this month that their vaccine will share with us their phase 3 clinical trials results from their vaccines. We've been doing a lot of work, as you know, to be prepared to use these vaccines. Our expectation is that by the end of November, early December, we may have vaccines that are available to our first phase of vaccine recipients, and that we'll look to the first quarter of 2021 for larger numbers of doses coming into the state. It's been an exciting time for the science of vaccines. The ability to test and produce vaccines in an 11-month period and make hundreds of millions of doses at the ready should the vaccine show itself to be safe and effective is really, really remarkable. So there's a lot of reason for excitement. At the same time, though, recognize that each of us will be in a different place in line when it comes to receiving this vaccine. Those first in line will be our healthcare workforce, our first responders, people who work with nursing homes and residential care facilities. Then we'll move into other essential workers and other high-risk folks. Indeed, when I think about my own work, I get to work from my home in the safety of my home office. It may not be till March before I'd really qualify for a vaccine. There are too many others in Colorado before me. And so each of us, recognizing that it may not be till the spring before we get our doses, has to maintain the discipline of all the steps we know work to reduce this pandemic. So I look to the vaccines as a light at the end of the tunnel. But for me, I think the tunnel may not be until March. And for many of us, it may be the spring. So while we're making our way towards that end of the tunnel, we need to be practicing the right behaviors to reduce as much as we can this pandemic. And with that, I'll turn it back to Heidi.
Great, thank you. And I'm going to take it over to Director Kevin Klein.
Unmute. There we go. Thank you. Good afternoon, Heidi, Dr. France. Thank you. Just a few updates from us in the Division of Homeland Security and Emergency Management. Since the beginning of the pandemic, we've been really, trying to get as much PPE and other medical supplies together in order to meet future increases in a future wave. At the governor's direction, we went ahead and, got a warehouse and started buying, additional PPE. Currently, we have about 6.2 million gloves in stock, 20.9 million masks. Now, the N95 masks are still very difficult to get. The supply chain is, has not caught up to the demand. We're saving those for healthcare workers, but we do have a lot of the KN95s, which we have tested in our own independent labs to make sure that they meet the standards. And we have another 10 million surgical masks that we have in stock. We've got gowns, about 1.3 million, some Tyvek coveralls, 3.1 million face shields, some hand sanitizer, thermometers. We've distributed 100 ventilators to Colorado hospitals, and we have another 20 in stock. So we've got a fairly good supply of PPE, but we're still working to make sure that we have enough to meet needs, and we're still relying on hospitals and other providers to get their PPE and make sure that they have a stockpile. That's all part of what we're trying to do to maintain healthcare capacity. And if we go to the next slide, we can talk a little bit about that. So I think a simple analogy that I really like is the overflowing bathtub analogy. So that's part of our managing the healthcare capacity. We've got space, stuff, and staff. We need to have all that to have capacity in our healthcare system. And first and foremost, if we've got the tub overflowing, we can turn down the flow, right? Turn off the water that's flowing into it. And that means doing the everybody, only interacting with their own household, keeping your distance, and wearing a mask. So all the things that Dr. France talked about, that's what we need to have happen to make sure that we do as much as we can to shut down the flow going into our healthcare system. We're working with the Colorado Hospital Association on steps to balance load among facilities and increase available beds within the facilities. And that's building a bigger tub, right? So we're working with them to expand that capacity within the facilities. And then as a very last resort, we do have alternative care sites, which is kind of drain the tub. We don't want to get to that position. We're going to do everything we can to build capacity within the existing facilities. But as the last resort, we do have facilities that we can move to. Staffing's still a challenge, and we are exercising some staffing contracts. And if we go to the next slide, we can take a look at those alternative care facilities. We've got 3. We think there'll be 2 to 4 weeks from the time that we decide to make them operational to bring them online, depending on which facility it is. We monitor daily the status of the hospitals, how many beds they have available, how many ICU beds, any critical staffing shortages, things like that we monitor on a daily basis. So we keep an eye on that. And then, as I said, we're working with the Colorado Hospital Association to make sure that we're doing whatever we can to build capacity with them. And then also if we end up needing to load balance between facilities with interfacility transfers, we'll be working with that before we start moving them into the alternative care sites. So really that's what I have, and I'll be available for questions.
Great, thank you. And with that, we'll move to the Q&A portion of today. So how we'll do this is if you want to use the raise hand function, we'll go ahead and I will call on you. And if you could say your outlet as well as your name, that would be great. And Erin, I'm going to start with you.
Great. Hi, this is Erin Prater with the Gazette in Colorado Springs and Denver. I was just wondering why the state isn't being more transparent. You know, we've heard a bit about this process of moving counties. Once a county hits a level or surpasses a level, they're supposed to have a two-week grace period. We're not hearing a lot more, though, about why some of these counties are waiting way longer than 2 weeks to be moved. So I'd like to hear a response to that. And also at this point, some of these counties are blowing through levels in a matter of days. Is controlling this virus a lost cause at this point? Thank you.
Thank you for the question. When we put the dial together this summer, it was in large part response to the desire to be a lot more surgical and focused in our interventions. After having closed the whole state down, it was apparent that we have such variability across our counties that having a dial that would honor any given county, both its disease levels as well as any other unique aspects of the community, was important. So we built the dial. We did that in close partnership with stakeholders across the state, and I heard some give us good grades for having built this. And we were excited about how we were able to dial it up and down, I think, over the summer. Certainly, once October hit and our numbers have been going up and up, it's meant that we've been very busy because we have so many counties that we work with, and the process is to really partner with them and identify ways that each of them can be successful. And so I would say that we have staff that are working very, very busily all day, every day to connect with our different counties, to work with them, to understand their plans, to correct their plans if the state doesn't feel like it's aggressive enough, to be very transparent with them about what the timelines are, that these steps need to be followed, and on this day of the next week or whatever it might be, you will be moved to this next level. So I would say if it doesn't feel as transparent to you, it may be in part because we have our heads down and we're just going hour by hour working with different counties to make sure that we're giving them what they need and being clear with them. And I would check with the local counties to get a sense too from their perspective how clear we've been with them. And I'm sorry, I forgot the second part of your question. And Heidi, you might remind me what the second part of her question was?
Yeah, I think we'll just trying to find her on our little list here. Erica, did we get you back? Or Erin, sorry. Well, we'll come back to Erin. Let's go ahead and go over to Mark Salinger. I'm going to go ahead and unmute you if you could say out like there you go, Erin. Oh, no worries. Go ahead.
Thank you. I had to unmute myself. Thank you. The second part of my question was, we see some of these counties just kind of blowing through these levels, in days time, way faster than, multiple levels in less than 2 weeks. Is controlling the spread of this virus in Colorado a lost cause at this point? Thank you.
Got you. Well, it's certainly growing fast across the state. One interesting aspect, of course, with these counties is that some of them have very small populations and they have small case numbers, and even a movement from 5 cases to 9 cases represents a blowing through at a different level, and yet it's rather a small small group of numbers that might actually be stable through the week. So it is important to think about each context and what's happening in each of the counties, how big are they? And we're definitely taking into consideration the size, the speed of their growth in our expectations. I do wonder, and we'll be continuing to work with these counties. How many of them will be saying, okay, it's time for us to go stay at home? And I think it's an important question, not only that the state's asking of them, but for you to be checking in with counties where you think there's a very high speed of growth. What other actions might they be ready to take? And are they considering stay at home? I know that we're having those conversations with them on a county by county level.
Great, thank you. Mark Salinger, I'm going to take it to you if you could say which outlet you're with.
Hi, this is Mark Salinger with 9 News. Even with all of the mitigation efforts that you're putting into place and that the governor is ordering and stay-at-home orders and closing restaurants earlier and limiting capacity and everything like that, are you concerned that that won't have an impact if people continue to gather in private where you can't control that? If they go to somebody's house and have a dinner party or things like that, is that a concern in how the virus is spreading right now in Colorado, even as you're doing mitigation efforts in public?
Yeah, thanks, Mark. We are certainly concerned that small gatherings in private homes with families and friends is a potential source for the spread. And even when we set up these different mitigation practices that are broader in scale, like minimizing the number of people in restaurants and church and houses of worship, may not be enough, which is why we put forward the executive order, I think it was on the 23rd, limiting these gatherings. And there's certainly a plea on our part to do, each of us to do our best to keep ourselves from having these gatherings, because we think it is an important place. This is a very serious time. We are doing a lot of work in partnering with the hospitals, understanding bed capacity, ICU beds, ventilators, working with them on scenarios so that we can understand, as Director Klein described, one might we have to open up these alternative care sites. Certainly what's on my mind is the day when an ICU bed is overwhelmed, and I would have to activate potential crisis standards of care for hospitals that allows hospitals to think about how they would triage the care. So imagine a day where you and I are both hospitalized around Christmas. I'm there because of a terrible car accident. You're there because you have COVID, and we both need an ICU bed, and there's only one bed available. Decisions will have to be made about which of us gets that ICU bed. So the work we're doing as individuals, as families, as households, as businesses, as counties, is really all about preventing that terrible time when triage might have to happen in our hospitals. And if we continue as we are, we will exceed our ICU bed capacity sometime in December. We will have to activate the crisis standards of care for hospitals, and we will be in a place where that kind of triage may be happening.
Great, thank you. We'll take it to Blair Miller. If you could also say what outlet you're with.
Hi, Dr. France and Director Klein. It's Blair Miller with Denver 7. Kind of have 2 questions here. The first is about the outbreak at the El Paso County Jail, and just curious as to whether or not you guys have been involved in that, and curious about the number changes, but also curious about the masks and whether or not jails in Colorado are doing enough to control the spread of COVID among the inmate population. And secondly, wondering just kind of if we saw roughly 1,200 more cases today than we saw the day before, how likely do you think it is that we are going to see those case numbers go down next week? Thank you.
I think maybe if we want to start with the last part of your question with perhaps Dr. France, and then We can get you some greater detail on the first two part of your question from the media info box, but I think Dr. France, if you want to take the piece about increases, and that would be great.
This pandemic is a bit like a coal train going through Colorado. It's got a lot of momentum, and whatever you do, it takes time for it to slow down with your actions. And so, do I expect these case numbers to be dropping in the next week? I don't know that they will. Our best hope would be that they might start to slow down in terms of the increase and then move into a plateau. So I would expect us to continue to see the numbers to rise over the next week. I am hopeful that the county level changes with mitigation will start to be reflected in a slowing down of the rate of increase of cases and then ultimately a plateau. I tend to look back at our experience over the spring and summer, where in March and April, when we did the total stay at home, it was about 19 days before we hit the plateau in hospitalization rates. So we kept going up for over 2 weeks. Then again in July, when we started going up, it took about 2 weeks before we plateaued. So these mitigation strategies take a couple weeks before they translate into a real slowdown of cases. And it represents the challenge that we have, which is you're taking action today with the hope that they will be impactful in 2 weeks. If cases continue to go up over these 2 weeks, it's clear that counties will need to do more to slow things down.
And Heidi, I can,
Thank you.
Blair, I can just let you know that our teams have been working closely with El Paso County and other, other counties as far as, testing and helping. We also have supplies that are available. So that type of stuff we have been working with them. I don't know the changing numbers because I haven't looked at them recently. But one of the things that we know is that for that population, they're not leaving the jail, right? It's the people that work there that are getting it in the community, and we need to just understand that the dynamics there and do what we can to mitigate that. And I know that the county sheriffs have been engaged in those activities, and we've been providing assistance to the extent that we can.
Great, thank you.
Okay, thank you both.
Great, and then if you have any additional follow-up, go ahead and shoot that over to media_info@state.co.us, and we'll help get you some answers. I'm going to take it over to Anusha, and if you could say which outlet you're with.
Hey, this is Anusha with 9 News. I had a follow-up question regarding the alternative care sites. From my understanding in talking with the Colorado Hospital Association, overall, the system still has some space, but we heard from some hospitals saying, you know what, we're really close to capacity at this point. They're starting to get nervous. So the first part of my question is, how close are we getting to having to use these alternative care sites depending on the entire system? And the last we talked to the state was that, places like the convention center was going to be for recovering COVID patients. Is that a set deal, or is that an ongoing dynamic conversation that it could be open to other people too?
Anusha, we've looked at various scenarios and various options. Going back to the bathtub analogy, there are a lot of different people that we could bring out. But I do know that, and what we have done is looked at, our planning and our work with the Colorado Hospital Association and with long-term care facilities as far as what those needs might be. Our plans still prioritize taking those COVID positive patients that no longer need hospital care, hospital level care, but still need some care or can't go into like a skilled nursing facility until they've been quarantined for a while. So our plans are to still take those COVID positive patients for the alternative care sites. We have looked at other alternatives like non-COVID positive patients, but we don't know that the alternative care sites really get us that much bang for the buck for offloading the hospitals. So we're really still focused on the COVID positive patients. Now, as far as the timing, we're following the models closely, and it's been pretty remarkable how well they've been tracking with what has been projected to what we're actually seeing for hospitalizations. So we're watching that. But like I said, our first priority is to treat people patients in hospitals, existing hospitals, instead of alternative care sites. So whatever we can do to build that capacity within the healthcare system in Colorado, we're working with CHA to do that. So we'll keep those facilities available, but if we can do more transfers of patients interfacility, if we can bring additional staff in to existing hospitals, we're going to try working on that first. We'll get 2 to 4 weeks depending on which facilities that we're looking at. The smaller facilities, a couple of weeks to get those stood up, and we can cut that down a little bit. Ideally, we'd like 4 weeks to get the convention center set up. We can probably cut that down to 2 weeks if we really get into a crunch. But we are tracking the models. The models have been tracking real well with what we're seeing in as far as hospitalizations, and we're working with our hospitals to see what we can do to help avoid having to use those facilities. But we are planning on having them as additional capacity as a last resort, really.
Great, thank you. Jesse, we'll take it over to you, and if you could say which outlet that you were with.
Sure, it's Jesse at the Colorado Sun. Thanks for taking my question. So counties and the state have indicated that they can't keep up with contact tracing anymore. And Dr. France, you talked about a surgical approach to dealing with the crisis. But how can you take a surgical approach if you don't know where the disease is spreading anymore because of contact tracing? Doesn't that make it more difficult to enact, specific restrictions like limiting households and, shutting down certain businesses?
Well, I think you're right. It becomes more difficult to be truly surgical if surgical means microsurgery. There still are opportunities that, what we do for Baca County versus Huerfano versus Arapahoe should be different. Our approaches should be different. It's true that we've exceeded the number, the cases today exceed the number that can be managed through contact tracing. And so we work our best. We communicate the importance that having symptoms of COVID mean you should stay home. You should let those you've been around with know that you have the symptoms so that they can self-quarantine. And we all have to do what we can with what we have today.
Great, thank you. Erica, I'm going to take it over to you, and please say which outlet you're with.
Hi, this is Erica Meltzer from Chalkbeat. Thanks for taking my question. We have seen a number of school districts go remote this week and last week, and frequently they are citing the quarantine guidelines that they have to follow. And in particular, that now that they are in level 3, they cannot use the targeted contact identification anymore. So I am curious if you all are having any conversations about allowing that more targeted quarantine even in level 3, or if you feel like the rules as they are now are important to containing spread in the schools that are still open.
So regarding schools, I think it is a complex issue. From my perspective, there seem to be these three forces that drive whatever final decision is made around schools. There's the health and safety of the children, and of course the concerns for COVID spread among children. And there, of course, we see that the primary school kids, K through 5, have a different biological infectious experience than the high school kids. So there's the considerations about what's safe for those children. There's the questions about the teachers, what's safe for them. Are they being exposed? Oftentimes, as you know, cases are actually brought in from staff who might catch it outside of the school and then might spread it among staff. And then what's the third? I'm blanking on what my third was for the moment, so my apologies for that. But it felt like there were more. It wasn't quite so simple as simply a quarantine issue that was driving. Oh, the third was parents, because of course parents have concerns, and we hear over and over again from parents about how can the school still be open if there's a high level of spread in the community? Is this safe? And the answer might differ if it's in an elementary school versus a high school. And each county and each school district looks at that question differently. So the three factors of parents, the children themselves, and the teachers all seem to blend in to make whatever decisions are made regarding remote schools. I don't think that a specific question around quarantine and the method of quarantine is the sole driver for decisions to go remote.
Well, what the district leaders are saying is that they're having complete operational breakdown because they don't have enough adults in the building to run the school. That's what they're all saying.
That's maybe one of a number of messages that they're saying. So they're saying a lot of different things about what their issues are. I'm sure that Heidi, we could follow up and talk find more information about some of the school districts. A lot of the school district work, of course, is done at the county level, and the state level is participating in the conversations. The decisions, though, on opening and closing are local in that regard.
Yes, absolutely. And Erica, we will definitely get back to you from the media info box. Now I'm going to go ahead and take it over to Jessica Seaman, and if you could say what outlet you're with.
Hi, it's Jessica with the Post. I have two questions. One is, you mentioned how long it takes for these mitigation plans to start to show the data on whether or not cases are slowing. How long do we have until we get to the point that no matter what, we're going to reach hospital capacity? And we've heard from the local public health agencies that they don't want to go alone with a stay-at-home order. Could we see a regional stay-at-home order with the state reluctant to do a statewide one?
Two very good questions. And I'll say that I enjoyed your article the other day about local versus state making decisions. I thought that was well written. The question about when would we potentially breach is one that's of high importance for us to understand. It's also a challenging question to get an answer that's specific. Here's the date where we're going to pass things through. And the reason it's been challenging is because of the good work that the hospital systems can do. When we work with the Colorado Hospital Association and the chief medical officers, and we say, gee, when are we going to hit that number and that capacity level? The conversation is about their ability to flex and to do more and to see more. And I think we see that across all our states where I've been hearing for weeks that things are overwhelmed in Wisconsin, and yet I don't see that their alternative care sites are packed to the gills with persons who are ill. So they're still managing within their hospital systems to take care of the people as tight as things are. And so that poses a challenge for us in finding a specific day by which we might be overwhelmed. That said, there's work underway as we speak to be more clear about what that date might be. I would very much like to know the date so I can be thinking about when to activate the crisis standards of care for hospitals. And more specifically, if it takes 2 to 3 to 4 weeks, if I'm told that, Dr. France, you'll need to activate the crisis standards of care on a given day, let's say the 25th of December, I'd like to know that by the 25th of November so that we can take actions that might slow things down so that I never have to make the activation of these triage hours in hospitals available. So it is a bit of a challenge. Are we so far along that we've lost the battle already? I don't think so. I think we still have tools in our tool belt that we can be using, and I think local leaders and state leaders will start to use those if absolutely necessary. Again, Jessica, you had a second part to that question.
Could we see a regional stay-at-home order? Because I know the counties don't want to go alone with it.
I could imagine a regional stay-at-home order. Again, it would be directed first by regional leadership. I know that the Metro Denver public health leaders all speak 2 times a week and have discussed the potential of this kind of a regional stay-at-home order. If there are political reasons that it can't be done and it's needed, I'm sure they'll then turn to the state to look for our help in making that happen. And I'm sure if we get to a place where that needs to happen, we'll be having those conversations both regionally and at the state level.
Great, thank you. John, I'm going to take it over to you, and if you could say which outlet that you're with.
Yeah, hi, everyone. It's John Ingold from the Colorado Sun. I had a question about vaccines and sort of the timeline that we're thinking about here. Dr. France, you mentioned that you thought vaccines might be available for the general public, sort of that phase 3 level starting in the spring. But at the GERC meeting earlier today, Diana Herrero talked about it potentially taking up to a year for everybody in Colorado who wants to get a vaccine to be able to get one. And I'm just wondering, what exactly are we thinking on the timeline here, just based on current information? When might people of the general public might be able to go to like their local Walgreens and get vaccinated?
You know, I'm hopeful that based on what we know today, that it could be March, April, that those kinds of vaccination opportunities will come our way. So I think there'll be tens of millions of doses hopefully coming to Colorado early in 2021. And you know that we have these prioritized groups, and so we'll work our way through each of those. The last group is the healthy 18 to 64-year-olds who are kind of left over after you've given the vaccines to the high-risk folks and the essential workers and so on. And so that last group, it may be summer before they start getting it, and it may take months for them to actually finally get vaccinated. So I think the surprise sounds strong. The next question, of course, is what will the evidence show? Who does this vaccine work for? Are there any challenges, like this vaccine works really well for older folks, this other vaccine not so much, and therefore we have to think about how we manage the supply to give the right vaccine to the right person. So there's a whole lot that we don't know about these vaccines. We know very little. We know a little bit from a couple of press releases, but we haven't seen any data. It hasn't been reviewed publicly. So a lot more to come, which means my estimate and Diana's estimate are probably the boundaries of that estimate, sometime early spring to through the year, all depending on how things turn out with how well these vaccines work.
Great, thank you.
Great, thank you. Vinny, I'm going to take it over to you, and if you could say which outlet that you're with.
Thank you, Heidi. This is Vinny Daljudes at Bloomberg News in Denver. Has the state advised Colorado hospitals on taking transfers from other states to maintain hospital capacity for Colorado residents. I think Utah has advised hospitals, if I'm not mistaken, to be vigilant. So I'm wondering what's going on here. Thank you very much.
States, our surrounding states, Montana, Wyoming, looking for bed capacity. We've brokered it and worked with hospital systems. I don't know, however, that we have more formal rules or guidance around how that might go. And I'll just check with Director Klein to see if you have insight there.
Thanks, Dr. France. We did ask, right, and right now in Colorado, I think we've identified only 25 patients that have come from other states. And some of that also goes in with, what that patient has, other needs, right? And so when you have centers of excellence like university hospital system, some patients coming from Wyoming, that doesn't surprise us. But right now, it's a very small number. And it's clearly something that we're looking at. We've looked at what other states are doing. And frankly, we've sent assistance to other states too, in the form of material. We haven't sent people, but we've sent material to other states to help them. So it is one thing that we do. All the states are members of an emergency management compact. And we have a system where we can ask for resources and trade back and forth. So we have an ongoing discussion, particularly within our region, to talk about that. But right now, we're not seeing either big requests to move people in or big requests to move stuff out of Colorado.
Great, thank you. And that is all the time we have for questions today. If you have a question and we didn't get to you, please send them over to media_info@state.co.us. And I guess final thoughts, if you have any, Dr. France or Director Klein, before we close out today.
Well, only my thanks for all the work you guys are doing and bringing this story and continuing with the message of having everybody do their part so that we can get this pandemic under control. Thank you very much.
Yeah, I appreciate the time that you've taken to be with us today. And as Dr. Fred said, everybody needs to do their part to clamp down on the transmission. And that's what we're encouraging everybody to do. So thank you.
Great, and thank you both. And then I'd also like to thank our ASL interpreter, Sean, for joining us today. And again, if you have any follow-up questions, please send those to media_info@state.co.us, and we'll see you for the next one. Thank you.